case of the hiccups, the mental or perceptual, cognitive aspects of REM become temporarily disconnected or desynchronized with the motor aspects. That is to say, the person begins to awaken, is fully aware of his surroundings, and also is aware of the fact that he's still paralyzed. Now, most people, when they have this experience, they don't say, oh, cool, temporary dysynchrony in the architecture of REM. They go, oh my God, I'm paralyzed. I must have some neurological disease. Now, about 30% of the population will have one of these episodes every now and then, often when you are jet-lagged or taking a nap during the daytime and so forth. About 5% of the population will have it accompanied by these hypnopompic upon awakening hallucinations, which is basically kind of dreaming with your eyes open. And that's what our subjects experience. Now, once they've had one of these episodes, they start talking to people and going to folks and including certain mental health professionals in Cambridge, Massachusetts, who will go unnamed, who then help them recover memories of what happened next. Because the idea here is that the most terrifying aspects of one of these encounters is repressed or dissociated. You got to relax the person, hypnotize them to bring forth the memories. And that is when you get these vivid recollections under hypnosis of being whisked out of the window, up into the spaceship, probed and all that sort of jazz by the aliens. So these are sort of these recovered memory sort of things. Now, when we were doing this, here, by the way, here's, just for the record, this business about the sleep paralysis is not confined to our subjects. This is a phenomenon that has been reported throughout history, throughout cultures, and what have you. It seems to be sort of a common psychobiological phenomenon, and then different cultures sort of create different creatures, if you will. So, for example, in this particular painting by the Swiss-born British painter, Henry Fuseli, a late 18th century painter, early exponent of Romanticism in painting. Now, it's called The Nightmare. There's the mare right there. Now, most sleep researchers say, that's not a nightmare. That's sleep paralysis. The lady's on her back like this, and this fat little guy with the pointy ears, that's an incubus, an agent of the devil. Now, see, this is 18th century Europe, okay? So the sort of images that get hallucinated by a person going through one of these is going to be appropriate to the cultural context. So then it was the incubus. There's fascinating records from the late 17th century in Salem, Massachusetts, of individuals providing depositions against accused witches. And they say they're lying in bed, they're paralyzed, etc., and they see what they called the spectral image projected into the bedroom of the witch, who then would get hanged on that basis. But of course, nowadays, it's just aliens. Now, when we did this research, we had no idea that these guys are out here. I call them in the repressed memory group. These are folks who believe they've been abducted by space aliens, but they don't have any memories. Now, you're probably thinking right about now, why would somebody come to the conclusion that they've been abducted by aliens when they don't have any memories of it? Well, that thought ran through our mind, too. And so we asked them, I said, well, why do you think you've been abducted by aliens, your memories? I said, well, that's easy. You see these marks? These, I suspect, are the result of alien probes. When I see pictures of E.T., I get panic attacks. Surely, this would not happen unless something happened that I can't remember. Or I wake up in the morning, twisted up like a pretzel. There's no way I could have gotten to that position without somebody doing this to me. And my personal favorite, I have a passion for reading science fiction. Explain that. So anybody in this audience who likes science fiction, now we know why. But these guys, so we asked, well, what happened to the memories? They say, well, they got pulled out of the brain by the aliens, or it happened in another dimension. That's why they can't remember it. But they're making an inference. They're a curious parallel to some of our original sexual abuse cases, where they make an inference about a memory that they can't get to, based on these indicators. Now, we also recruited a group of a control group. These are people, our control subjects are, people who deny ever having been abducted by aliens. They are, that's the main criteria. We can still find them in Cambridge today. These subjects, by the way, these are real people, not college students. So, we recruit them for the community, match them on age, so it's not undergraduates or anything like this. Now, what we did in this particular study, this is there's a standard task for testing sort of false memory propensity in the laboratory. None of the material in this particular task have anything to do with emotion or trauma, et cetera, but it's called the Diess-Roddiger-McDermott paradigm. Basically what happens here is the subjects hear 24 study lists that vary in terms of the number of semantic associates. I'll give you an example of this in a moment. So they study all these lists, and then they get this math problem afterwards, simple math problems, and then we ask them to recall all of the words on the list that they just saw. Then there's also a final recognition test. Now, the key thing is that for each of these lists, they all sort of converge on a theme or a gist. And there's one particular word that captures the essence of the list, but it's not actually presented. That's called the critical lure. So the question is, will the person get sort of sucked in by the gist and affirm having seen, having encountered the item that in fact was not presented? So this is how you sort of test kind of for a general false memory. Say, yeah, I remember seeing that. So for example, these are the type of lists that you use in DRM paradigms. So here's a bunch of words. Now in this case, all of the words converge on a common theme. So we got here bed, rest, awake, tired, dream, wake, night, blanket, doze, slumber, snore, pillow, peace, yawn, and drowsy. And as Sherlock Holmes might have said, the dog that didn't bark in the night. The word that you'd expect to see on this list that's not there is in fact sleep. There you go. And so it's this type of procedure. And so when you give these people these lists, will they take the bait and get sucked in and say, yeah, I saw sleep. I know I saw sleep. Okay, that's the idea. So what we have, these are the data on false recall, the average across all of the lists. Now, here's the control group, the repressed memory group. Those are the people who think they've been abducted. The recovered memory group. Basically, what you see here is you see about twice the rate of false recalls for the two groups that who believe they have been abducted by aliens, whether they remember it or they don't. This is for false recall. Now, when you actually just focus in on the 15 associate lists, like the one I just showed you, everybody tends to have a greater tendency to fall prey and say sleep. In fact, there's somebody here, folks did it right here. But what happens is you see still the rate is about twice as high in the alien folks than in the control subjects who deny a history of alien abduction. Now, with false recognition, you get the same sort of pattern. With recognition tests, you tend to get higher false memory effects, and this is true here, and it's also true for the 15 associates. So basically, what we found here then is that adults reporting either repressed or recovered memories of space alien abduction exhibit heightened propensity for false memories in the laboratory. So we've gotten two different groups now that have reported this memory recovery phenomena that show this sort of a curious tendency in the laboratory. We're studying a third group later. I don't know if I'll have time to mention them, but okay. The second study, this is the one that Michael alluded to that came out fairly recently, was designed to answer the question, do alien abductees, quote unquote, exhibit psychophysiologic signature of PTSD while listening to trauma scripts of their abduction experiences? Now, the reason why we are curious about this is that if somebody who has been traumatized, who actually has this traumatic memory, is haunted by it, who has post-traumatic stress disorder, PTSD, and when they hear a tape that describes their autobiographical memories of trauma, they will show heightened physiologic reactivity to that memory. Now, our question is that we assume these guys were not actually abducted by space aliens. And so, therefore, we're asking the question, will a false memory drive a physiology hitherto attributed to the sort of a Pavlovian fear conditioning that results when somebody has been in combat and has PTSD as a result? That's kind of the general idea. Or do you really have to be abducted to show the psychophysiologic signature? Now, the procedure we used here is called a script-driven imagery paradigm. It was devised by Peter Lang to study phobia patients some years ago, and then adapted for autobiographical trauma memories by my colleagues Scott Orr and Roger Pittman. Basically, what we do is follows. We get the subject to write down a narrative of their traumatic memory. In this case, the traumatic memories are their most terrifying encounters with space aliens. Now, the stressful memories that we have them write down are other very, turns out for these subjects, were quite distressing experiences. So they write these down. Then we also have autobiographical memories that are positive. They often say like the birth of your first child, or neutral, like doing the lawn last Saturday or washing the dishes last night, kind of boring. And so then what we do is we take these narratives and we put them into 30-second audio tape scripts, and we play the scripts back to the subjects in the laboratory while we measure their psychophysiologic responses. So we measure heart rate, how fast their heart is beating as they are listening to these different memories, because they're supposed to recall what they're hearing, right, their memories. Skin conductance response, that's sweating on the palm of the hand. And electromyographic activity, that's facial muscle tension. So the person's sitting there in the lab and they're hearing these things, grimacing and heart's pounding and they're sweating and so forth. So we're measuring that stuff. Now, to give you an example of what these type of scripts look like from our previous work, this is from Vietnam veteran. Of course, with this script and the one I'll show you in a moment, the details are concealed, so there's no way you can identify who this person happened to be. But this is to give you the idea of what these scripts are like. It's May 1968. You're on an ambush just north of blank when your unit encounters a divisional-size force. As the area becomes illuminated, the enemy attacked with hand grenades. Your eyes open wide as hand-to-hand combat breaks out. You feel so frightened that your teeth cannot stop chattering. A grenade hits you in the head and your heart begins to pound. You pick it up and throw it. The grenade explodes, wounding you. Your whole body shakes. Now, if someone has post-traumatic stress disorders as a result of Vietnam and hears this particular memory, they'll show their reactivity. And if they do not have PTSD, they'll report the stress, but they won't show the physiology. Okay, our alien abduction group, 6 women, 4 men, sleep paralysis, hypnopompic hallucinations. 8 out of the 10 had been in recovered memory sessions, which they found all sorts of wild memories. 70% of them mentioned encountering their hybrid offspring or otherwise having sex with aliens. So this is the material that comes up when they do these so-called hypnotic regressions. So when you really ask alien abductees, they start talking about their encounters. You have to be very careful about under what circumstances did you remember this? It's not as if these things are happening in the daytime or they're remembering them every day. They get abducted and they remember it right away. No, they go into these unnamed therapists who then help them remember these things. It's sort of interesting. These folks are into a lot of stuff. Tarot cards for telling the future. Oh, yeah. Astrology, bioenergetic healing therapies, alternative remedies. They believe in ghosts. And here is a key point. It really makes them very different from the CSA survivors. 90% of them also say that they are very spiritual individuals, and this plays a role in this. I mention this because when one of our studies, the first study got published, we were getting attacked by our local enemies in the New York Times who said that we are trying to silence the voices of survivors by equating, quote unquote, space alien abductees with sexual abuse survivors. We're not doing that. As you can see, there is in fact some connection, but there's big differences of which I will cover a bit later. So I should also mention, I don't have this up here, but we also did psychiatric assessments of the subjects. John Mack has always said that these people are not, quote-unquote, crazy, and they're not liars. I think he's absolutely correct in both cases. You find no evidence of serious mental illness here. You occasional past depression or a panic disorder in the past and what have you, but nothing that could account. You're not seeing schizophrenia, active mental illness. I think the explanation for this is more interesting. Now, our control group, these guys are a little bit less into these sorts of things. Alternative verbal memories. 42% of them believe in ghosts, Step outside the academy. There's more things out there, I tell you. At any event, what's very interesting, the physiology data tell a little bit different story from the psychometric data. I mentioned the psychiatric assessments don't reveal psychopathology. But when we see our subjects, they're doing quite well. I'm referring to the abductees. They're not anxious. They are not depressed. In fact, you can tell that they're not depressed simply by looking at their beady eyes. The Beck Depression Inventory score I'm referring to, of course, the beady eyes, is... you can't diagnose mood disorder by looking at a person's pupils. Obviously, no, I'm referring to the beady eye, of course, is you check depression, screen for depression by looking at the beady eyes, and they're, of these subjects, 3.6, that is really, really low. If this were up around 21, you'd start suspecting depression, Okay, so they're doing fine here. Trade anxiety, same thing. Very normal, etc., nothing out of the ordinary. However, where you see some